name is Whitney Patton. I'm a physical therapist. Welcome to the Move to Mobility video series. In this episode, we'll be talking about a topic that we have many questions about, an effective yoga practice. We'll talk about some general guidelines to introduce you to yoga, and we'll show you some yoga poses with modifications that you can do if you have arthritis. The goal is for you to feel comfortable practicing yoga at home or in a community setting. Yoga is for everybody, whether you're a man or a woman, whether you're flexible or not. Research has shown that yoga can be safe and effective if you have arthritis. Most yoga poses can be modified using blocks, straps, or pillows so that you can do each pose to your degree. And that way, you can improve your flexibility. Yoga has also been shown to improve strength, balance, and posture. It can reduce stress, and it can increase your well-being overall. Though more research is needed, studies are beginning to show that doing yoga twice a week for 60 minutes can get these effects. If you're new to yoga, look for a program in your community that is Hatha, Iyengar, restorative, gentle vinyasa, or a combination of these. It is best to avoid in the beginning Bikram yoga or hot yoga. Your pain should not increase in a yoga pose. If you experience pain, that's a sign to back off. Ask your teacher for a modification or use one of the modifications that we'll show you next. Next, we'll show you some basic yoga poses that you may see in a community class. For each pose, we'll show you modifications that you can do so that you can feel more comfortable to take the class or practice on your own. The yoga poses we will show you use these props: a pillow, a blanket, and a yoga mat. If you are purchasing a yoga mat, you may want to look for a thick yoga mat to provide extra padding for sore joints. If you choose to do a community class, many studios will also have blocks, straps, and pillows available for you to use during your practice. Child's pose helps to stretch and release the low back, hip, and shoulder muscles. It is often the first pose in a yoga series and is a great place to establish the focus on breath, which is the foundation for yoga. With every pose, breathe in through your nose and out through your nose. If your low back is tight, try placing a pillow between your buttocks and your legs. If reaching your arms in front of you is painful, try relaxing your arms at your side. If you have knee pain, try placing a blanket below your knees. You can do this with any yoga pose to relieve knee pain. For painful hips, adjust your knees to be wider or narrower. Try placing a pillow under your belly. The goal is to feel a gentle stretch in your hips, low back, and shoulders. This pose and other poses should be restful and not painful. Traditional cat-cow is done from a hands and knees position with palms flat. This provides nice motion and stretch to the upper and lower back by drawing your belly to the ground, tailbone to the sky in cow, and arching your back, drawing your tailbone to the ground, and tucking your chin to your chest for cat. For wrist pain, try making fists instead of palms flat. For knee pain, try using a blanket for padding. Cat-cow can also be done while sitting in a chair or on your knees if you have severe hip, knee, wrist, or shoulder pain. If you take a community class, forward fold is used as a release for the low back and hamstrings, the large muscles in the back of your thigh. Forward fold is also used as a transition to other poses. Forward fold can be modified by bending your knees and hips to a degree that is comfortable for you, keeping in mind that the poses should not increase pain. Here you will see a common part of a traditional yoga flow: downward facing dog to high push-up to low push-up to upward facing dog and returning to downward facing dog. These poses can be modified to your degree. Upward facing dog can be replaced by baby cobra, lying on your belly and gently lifting your head and shoulders to your degree, being sure not to create increased low back pain. You can then return to downward facing dog by going through a hands and knees position. Knees may be bent to your degree in downward facing dog if you have tight hamstrings. Downward facing dog may be done with support of a chair or couch for tight legs, shoulders, or back. Lower your chest to your degree. Bend your knees to your degree. Remember to breathe with every pose. Supine twist provides a stretch to the low back, hips, and chest muscles. It is done by extending one leg, bending the other, and bringing your knee across your body. Your arms should be extended to feel a gentle stretch across your chest. Supine twist can be modified by placing a pillow to support your knee. Your extended arm can be modified to be closer to your side or bent at the elbow if you have limited shoulder motion. Here you see Warrior 1. You will notice her front knee is in line with her ankle to decrease stress on the joint. The back foot is angled, hips are facing forward. In Warrior 2, her front knee will stay in line with her ankle. Hips will face the side wall, and the back foot will point to the side wall. Any standing pose, including the warrior poses, can be modified using a chair or a wall for support if balance is an issue for you. Don't hesitate to set your mat up next to a wall during a community class so you have support when you need it. The yoga poses we have shown you are just a sample of some of the common yoga poses you will see in a community class. You should feel encouraged to explore some of the classes in your community and find one that works for you. There's a whole variety out there. Remember, yoga should not increase your pain. The most important thing is to listen to your body. Take a deep breath and remember, yoga is for everybody. Thanks for watching. Be sure to check out the other videos in our series.